Hi, my name is Dr. Prakar Mehrotra. I'm the founder and owner of Ridge Oral Surgery and Dental Implants in Basking Ridge, New Jersey. Post-operative recovery is very important. So the first thing we talk about is bleeding. Some bleeding is normal. After the procedure, we will have you bite down on gauze at the surgical site to stop the bleeding. In approximately an hour, when you leave from our practice, you take the gauze out, eat something cold, put a fresh gauze back in. You would keep changing the gauze every 1 hour or so for 2 to 3 hours. In 2 to 3 hours, if the bleeding has stopped, there is no need to use further gauze. If there is still some bleeding, you may continue to use the gauze after. There is also the option of using black tea bags soaked in cold water, squeeze it and bite down on it if the gauze is not working out. If there's any issues, please give us a call. In terms of swelling, some swelling is normal, or post-operative day 3 is the worst of the swelling, and then swelling will go down. We do recommend icing the surgical site from the external surface 20 minutes on, 20 minutes off for at least 48 hours if possible. In terms of sleeping at night, typically we recommend extra pillows to prop the head up to help gravity bring the swelling down. Usually swelling will take 5 to 7 days for it to be completely resolved, depending upon the complexity of the surgery. In terms of rinsing, we typically recommend do not swish, spit, brush, rinse for at least 24 hours. If you spit or swish, the blood clot can get dislodged from the surgical site and you may end up with bleeding or dry sockets. In terms of rinsing, so first day we recommend don't brush or rinse, but the next day you can start gentle warm salt water gargles, and gentle brushing is okay, just be careful at the surgical site. In 3 to 4 days, regular brushing and rinsing can resume. We will also provide you with a surgical syringe to help keep the surgical site clean that you can start using in 3 to 4 days after the surgical procedure. Typically, you would be prescribed an antibiotic rinse known as Paradex or chlorhexidine, and do not use that rinse for more than 2 weeks because it can stain your teeth. Sutures. Sutures will typically dissolve by themselves. We don't need to remove them. Let's talk about medications. Typically, you will be prescribed 3 types of medications. There would be an antibiotic, there would be some pain medications, and there will be an antibiotic rinse. In terms of antibiotics, just take them as prescribed. They are very important to prevent any infections or treat any current infections that the patient has. We prefer not to start with the stronger pain pills or opioids, especially for younger patients. We prefer to stick to the NSAIDs, that is ibuprofen and Tylenol. We recommend taking ibuprofen and Tylenol in combination and taking it on a scheduled basis for at least 2 to 3 days after the surgery. If necessary, you will be prescribed the stronger pain pills, but those are always a second line of pain medications. In terms of eating, the order of the day is cold and soft. So you want ice cream, smoothies, shakes, yogurt, jello, pudding, applesauce. Just avoid anything super hot, hard, crunchy little pieces that get stuck into the surgical site. Even the second day, most patients can eat overcooked pasta, mashed potatoes, scrambled eggs. So you want something that's cool, soft, and doesn't get stuck into the surgical site because that may end up causing an infection. Most patients within a week are pretty much back to regular food and regular diet, but they're still avoiding crunchy stuff like chips, nuts, pretzels, popcorns, anything that can get stuck into the surgical site. Some specific instructions for any procedures involving the sinus, either it's a sinus closure or an oroantral communication. Typically, we recommend no nose blowing, no heavy lifting more than 25 to 30 pounds for a few weeks after the procedure. And if you're sneezing, we recommend keeping the nose and mouth open to avoid putting any pressure at the surgical site so the stitches don't open up for 4 to 6 weeks out from the procedure. In terms of numbness, typically, because we do give you numbing medication, the lip and the chin may be numb for a few hours after the procedure. Typically, we recommend not to chew or eat so you do not bite into them by mistake. The numbness will wear off in a few hours and up to a day. If you're still numb after the first day or 2, kindly call us and let us know so we can let you know the next steps. Typically for follow-up, we would be seeing you for follow-up a week out from the procedure to make sure things are going in the right direction. If you need anything beforehand, if you have any questions in terms of post-operative care, we are reachable 24/7 via text and cell phone, even after hours. So these are general post-operative instructions applicable for most oral surgery procedures. As necessary, we will provide you personalized instructions after your procedure. You're going to be just fine. We are here for you.